Hello students, welcome to iReach. Today we are going to learn about the next organ, which is spleen. So let's get started. First we'll see introduction. Spleen is a lymphatic organ connected to the blood vascular system. Why spleen is called as a lymphatic organ? A lymphatic organ is an organ that produces, stores or helps in the activity of the lymphocytes, which are the cells of the immune system, and protects the body against infections. So it is a part of the immune system that helps the body fights infection or germs. And spleen also contains lymphoid tissues which helps in immune response. So due to its immune response or role in the immune system, the spleen is called as a lymphatic organ. Next is Galen called it a organ of mystery. So Galen was a Greek physician, surgeon or philosopher. Galen called the spleen an organ of mystery because its exact functions was not clearly understood in his time. Unlike the heart, liver or lungs, removal or diseases of the spleen did not cause immediate death. So the spleen showed variable sizes and appearance in different people and conditions, and it also had no obvious duct or secretion, making its role quite confusing. So Galen could see the spleen but could not clearly explain what it does. So he considered it mysterious and called it an organ of mystery. Spleen acts as a filter for blood. We'll learn about it, why, how the spleen acts as a filter for blood in further slides when we learn about the arterial supply of spleen. It plays an important role in immune response. We have already discussed it. Spleen is a soft, highly vascular and dark purple in color. Shape of the spleen is wedge shaped or it is tetrahedral in shape. Wedge because it is wedged between the fundus of stomach and diaphragm. That's why it gets the irregular shapes, and it is considered as a wedge shape or tetrahedral in shape. Now we'll see the locations and measurement of spleen. So there is a simple odd number theory to remember the measurements of spleen, which is spleen is 1 inch thick, it is 5 inches long, 3-inch broad and 7 ounce, that means 150 gram in weight. Now we'll see the locations of spleen. So spleen is related to 9th to 11th ribs. We can see here in this picture, spleen is related to 9th, 10th and 11th rib. It lies opposite 10th, 11th and 12th ribs behind mid-axillary line under diaphragm. What is mid-axillary line? The imaginary line that is drawn exactly in the middle of the axilla, that divides the axilla into two equal parts, is the mid-axillary line. So spleen lies behind that mid-axillary line under the diaphragm, opposite to 10th, 11th and 12th ribs. The long axis lies along the 10th rib. So the spleen's long axis lies along the 10th rib. As we can see or appreciate here in this picture, this could be a long axis of spleen which lies exactly opposite to the 12th rib. Okay. And spleen lies mainly in the left hypochondrium and partly in the epigastrium. As we can see here, the 9 regions of abdomen. So spleen lies mainly in left hypochondrium and partly in the epigastrium. So these are the things that you should be remember. Next, now we'll see the positioning of the spleen in the body. So we have already discussed that it lies obliquely along the long axis of the 10th rib. It is directed downward, forward and laterally. As we can appreciate in this picture, the spleen is directed downward, forward and laterally. It makes an angle of about 45 degrees with the horizontal plane. So what is horizontal plane? Horizontal plane is an imaginary line that divides the body into upper and lower parts. If we cut the body at the level of the umbilicus, we'll get the two equal parts. First is upper part and second is lower part. So as we know that the spleen lies obliquely along the 10th rib, so with the horizontal plane it makes an angle of about 45 degrees, as we can appreciate in this picture. Moving on, Now we'll go to the external features of spleen. So in a nutshell, spleen has two ends, which is anterior and posterior, two surfaces, diaphragmatic and visceral, two angles, anterobasal and posterobasal, three borders, superior, inferior and intermediate, and a hilum. Now we'll see one by one each borders and ends and surfaces. First we'll start with the ends. So spleen has two ends. First is anterior and next is posterior. Anterior end is also called as lateral end because it is present laterally. So we can see the one end anterior, which is present anteriorly plus laterally, is the anterior end which is expanded. So this end is quite expanded. It is directed downward and forward, and it reaches the mid axillary line or 3 centimeter beyond it. As we have already discussed that the spleen is related to the mid axillary line or lies behind the mid axillary line, or sometimes it reaches up to it. The second end is the posterior end, which is also called as medial end because it is present posteriorly as well as medially, as we can appreciate in this picture. So the posterior end is rounded. We can see here the posterior end is rounded, unlike the anterior end which is expanded. It is directed upward, backward and medially, and it rests on the upper pole of the left kidney. As the kidney lies behind that spleen, so the posterior end rests on the upper pore of the left kidney. Moving on, now we'll see the borders of the spleen. So spleen has three borders: superior, inferior and intermediate border. So superior border is notched near anterior end. We can see, so this is the superior border, as we can appreciate, and you can see there is a notching of superior border. It is notched near its anterior end. So this is a this notching happen during the developmental process, as initially in the intrauterine life spleen is present in a different lobes, and when these different lobes combine with each other or fuses with each other, they left with the left with these types of notching. When the nodule fuse together to form a single spleen, the line of fusion is left with the notches which is present on the superior border. As we can see here, the notches are present. That's why the superior border is notched near its anterior end. Next is the inferior border. So we can see the inferior border is the border which is rounded, present inferiorly, or this border is rounded. And the third one is the intermediate border. Intermediate border is rounded and it is directed to the right. So we can see, or we can appreciate here, this is the intermediate border. To make it more clear, this could be a intermediate border which is directed towards the right, and it is present between the superior border and inferior border. Next we'll see the surfaces of spleen. So spleen has two surfaces. First is diaphragmatic surface and second is visceral surface. So diaphragmatic surface is the surface which is present outside or which is related to the diaphragm, and it is convex and smooth. So the surface which is behind this portion, at the portion we are seeing in the picture, the surface which is behind this picture is the diaphragmatic surface, which is convex and smooth, and visceral surface is the surface which we are appreciating here, which is concave and irregular. You can see there is a concave surface and it is irregular in appearance. Moving on, now we'll see the angles of spleen. So it has two angles. First is anterobasal and second is posterobasal. Anterobasal angle is a junction of the superior border with the anterior end. We can see this is the superior border as we have know, which is notched near the anterior end, and this would be a anterior end of the spleen. So the angle which is made here is the anterobasal angle. It is the most projecting part of the spleen. So this portion is the most forward projecting part. This portion is the most forward projecting part of the spleen, and it is also called as a clinical angle of the spleen. Why? Because when there is a splenomegaly, that means when the spleen is enlarged, so it is felt first. This portion is felt first during splenomegaly. Next is we have posterobasal. So posterobasal is a junction of the inferior border with the anterior end. Same as the anterobasal, we have the posterobasal angle. So the angle between the inferior border, and the anterior end, this angle is the posterobasal angle. So spleen has two angles that we have witnessed. First is anterobasal angle, and second is posterobasal angle. And now the last feature of the spleen is the hilum. It lies between the superior and intermediate border. First thing, what is hilum? Hilum is the depression that is present in the organ, in the center of the organ, through which the different vessels or many contents passes into the organ. So the in spleen, the hilum lies between the superior and intermediate border. As we can appreciate here in this picture, we can clearly see uh, this is the portion of the hilum which is present between the superior border and the intermediate border. Okay, and it is pierced by branches and tributaries of splenic vessels. This hilum is pierced by various branches and tributaries of splenic arteries and splenic veins. That's all for today's lecture. In next lecture, we'll continue the remaining parts of the organ of the spleen. Until then, keep reading. Don't forget to like, share and subscribe. Thank you.